Number 14, Pericare. In this skill, we'll be cleaning the front side and the back side of the resident. Our supplies for this is going to be 2 towels, 2 washcloths, 2 pairs of gloves, 2 chucks, a basin, and soap. Knock, knock. Hi, Miss Susie. How are you doing today? My name's Michelle. I'm your CNA. I'm here to do Pericare. Is this a good time? She says yes. Here's your call light. Shut the curtain and wash my hands. Now, I'm going to come over here. I'm going to put 1 pair of gloves on and grab an additional pair. I'm going to grab 2 towels, 2 washcloths, and 2 chucks. Place my barrier towel down. Miss Susie, is it okay if I go in your drawer? She says, sure. I'm going to grab my basin and my soap. Now, when you have a resident that does not have a catheter, they're always laying on a chuck. This way, in case they sneeze, cough, laugh, if a little urine comes out, it protects the bedding. So I'm going to go ahead and put my 1 pair of gloves on, my first pair. At this point, she will have a chuck under her already. So I'm going to go ahead, have her lean away, roll the dirty chuck up, have her lean towards me, pull it out, and throw that dirty chuck away. Now, because I've done that, my gloves are soiled. I'm going to remove the dirty gloves, throw them in my garbage, and put my new gloves on. Now I want to put a clean, new chuck under Miss Susie. Miss Susie, go ahead and lean away from me on 3. 1, 2, 3. Okay, lean towards me. Great. At this point, I'm going to go get my water. I gave her her call light. I want to put 3 inches of warm water. When I come back, I'll test it. Miss Susie will test it, as well as the examiner. I'm going to put my washcloths in, bring her gown up, and put my drying towel across her abdomen. Again, like catheter care, we're going to go ahead and make that taco. I'm going to wring this out, put 3 squirts of soap, and build a lather. Our first piece, we're going to clean the middle from top to bottom. This side, inside and outside the labia from top to bottom. Inside and outside the top or the other labia. And across the top. Put that on the side. Wring this out. And now rinse the same way. Down the middle. Down the side. Down the other side. And across the top. We're going to go ahead and dry Miss Susie to make sure that she gets nice and dry. Now all we have left is cleaning her backside. Miss Susie, on the count of 3, I'm going to have you scooch towards me. 1, 2, 3. Please cross your arms and legs and roll to your side. We're going to place our towel under her butt. This way we have double protection for the. We're going to go ahead and clean the backside now. Rinse my wash rag, put some soap on it again, and build a lather. We're going to go up the middle, from the rectum up through the butt cheeks, the rectum under the butt cheek, rectum under this butt cheek, and across the top. We're now going to rinse the same way. Wring this out. Rinse up the middle, under the butt cheek, under this butt cheek, and across the top. We're going to dry with different parts of our towel. And then we want to leave Miss Susie on a clean chuck So we're gonna roll this dirty one away from us. Grab our new one. And lay her down. Miss Susie, lean towards me. Okay. Good job, Miss Susie. Here's your call light. I'm gonna go ahead and put my soap back in my drawer. My chuck is gonna go in the garbage. I'm gonna roll my towels up and put them in the wet hamper. Put my table away. We're gonna go to the restroom and dump this in the toilet since it's from the waist down. We're gonna turn our water on, lift up the toilet seat and lid, dump, rinse, dump, rinse, dump, rinse, dump. Grab a paper towel, pat it dry, spray it, set it on a barrier. Go ahead and close your toilet, flush it, remove your soiled gloves, wash your hands, grab another paper towel, pick this up, and throw that one away. We'll now place this back into our drawer. Miss Susie, you have your call light. If you need me, give me a call. Open the curtain and we're done.